complications and contraindications for bone marrow transplantation in children?
Yes, I think bone marrow transplantation is one of the advanced treatment method in many disease condition in children. It can be malignant, it can be non-malignant. In non-malignant conditions, which include mainly the leukemia, both in ALL and AML, we do bone marrow transplantation in specific situation. Other malignant condition, we do autologous bone marrow transplantation like neuroblastoma, Hodgkin's lymphoma, even relapse brain tumor. In benign condition, that is non-malignant condition, we do bone marrow transplantation for thalassemia, sickle cell disease, aplastic anemia in primary immunodeficiency disease.
How is donor and recipient compatibility ensured for successful bone marrow transplantation?
Yes, one of the important steps we do before we do the transplantation is HLA matching. That is the most important. So when we think about doing bone marrow transplantation, first for the both patient as well as potential donors, mainly the brothers and sisters or extended family members, we do HLA matching. What is the best match? They are going to be the donor. But there are other things like blood group, same gender, all these things need to be considered before we choose donor for bone marrow transplantation.
What complications can arise after bone marrow transplantation in children and how to prevent and treat it?
Okay. See, bone marrow transplantation is highly technical and advanced procedure, and what we do in bone marrow transplantation is we initially give a lot of chemotherapy that will suppress the immunity as well as suppress the bone marrow, as well as it can also cause toxicity in the liver and kidney. So because of that, immunity will be very less during the bone marrow transplantation as well as after. So they can get a lot of infection. So we keep the children in a special room to prevent infection, and if there is an evidence of infection, we treat them with a different antibiotic.
What's the impact of bone marrow transplantation on the quality of the children and their rehabilitation after the procedure?
Yes. See, bone marrow transplantation is life-saving and life-changing procedure in certain condition in children. For example, in thalassemia, they cannot survive without regular blood transfusion. But if you do bone marrow transplantation successfully, then they don't need to get blood transfusion. Similarly, sickle cell disease, they get regular pain and different complications. But if you successfully do the transplant, then that is the end of it. So the quality of life is improved in many conditions. And in case of leukemia, it is a life-changing, and otherwise patient will die. So after the bone marrow transplantation, there are short-term and long-term side effects. Overall, with effective management, their quality of life is much better than before.
And the last one, what are the prospects for developing and improving pediatric bone marrow transplantation procedures in the future?
Yes, I think the first bone marrow transplantation happened 1968, almost 60 years back. And in fact, first bone marrow transplantation was happened in children, not in adult. And since then, there are a lot of improvement, and now overall survival rate after transplantation is almost like 90% in certain condition. And in various centers, a lot of studies are going on, and in future, I think bone marrow transplantation is going to be one of the common procedure in every country, and we would be able to do bone marrow transplantation much better way without much complications.